Hello everyone, welcome back to the MLA Concept Map walkthrough. Today we're going to walk you through obstetrics and gynecology. This is something that will most definitely show up in your exams, whether you're giving your MCQ exams or your OSCE stations. You can be sure that something is going to show up from obs and gyne. To begin with, we have anemia in the context of pregnancy and in the context of heavy periods. You should know how to manage it, how to interpret investigations, what investigations to order. Okay, this is important. It is commonly tested. Atrophic vaginitis in the case of postmenopausal female, bacterial vaginosis, Gardnerella vaginalis, the difference between Gardnerella and Trichomonas, and how you're going to investigate this, how you're going to manage this. Know this because this is also commonly tested. Cervical cancer and cervical screening. So this is something that they test you on in a multitude, in a variety of different scenarios. Okay, so really do this well. Know the age group, know the protocol for cervical screening, know HPV, how a patient can contract HPV, high risk, low risk strains. Okay, know about cervical cancer, the presentation, the risk factors. Really do this well because this is very commonly tested no matter what exam you're sitting for. Chlamydia, STI, ophthalmian, neonatal, neonatal conjunctivitis, gum clinic, partner notification program, all that STI stuff is how chlamydia may show up. Cord prolapse is an emergency scenario. This is something that I have not seen show up in the past, but it could show up now as an emergency scenario in your OSCE station, so know what you're going to do in these cases. And in your MCQ stations as well, you might be asked the initial most appropriate thing you need to do or the definitive treatment for this. Depression, postpartum blues, postpartum psychosis. Know this in that context. Next, you have diabetes in pregnancy. Know the difference between gestational and pre-existing diabetes and how to manage this, how to investigate this. This is also something that has shown up in the past. Ectopic pregnancy, a patient may show up and they may not know they're pregnant. They may just have abdominal pain, very severe abdominal pain, a ruptured ectopic pregnancy may show up. So you need to know how to investigate this patient and what to do for them. This does commonly show up in your exams. Endometrial cancer, know the risk factors, know the most likely age group, know what kind of patients will get endometrial cancer. Endometriosis, this hasn't shown up as much in your OSCE stations, I would say, more so in your multiple choice question exams. However, it could show up in your OSCE stations as well, so know the investigations you're going to do and how to explain this to the patient and when you're going to suspect endometriosis. So cyclical pain that's in the pelvis or the lower abdomen is how this usually shows up. Epilepsy. So epilepsy may show up as eclampsia in the case of obstetrics. So know what drugs you're going to use, how you're going to manage the patient, what you're going to do for them. This is a very favorite topic in your multiple choice questions, but it may show up in your OSCE station as well. Essential or secondary hypertension. So gestational hypertension is something that you should know. Preeclampsia is something that you should know really well. Fibroids. What ethnicity is affected by fibroids? Africans usually. You need to know about intrauterine implants and fibroids. So which ones you can give to the patient, which ones you need to avoid, or when you need to avoid intrauterine implants in the case of fibroids. So yeah, and also how this presents and what kind of symptoms you get. Gonorrhea is very similar to chlamydia. Just know the difference. Know when you're going to suspect gonorrhea. Menopause, perimenopause, premenopause, menopause itself is something that is commonly tested. Know how the patient presents in each of those scenarios and what you're going to do for the patient. Obesity and pregnancy. Know the complications that the patient could face because of obesity in pregnancy. Okay. Obesity may actually show up in the context of polycystic ovarian syndrome and infertility as well. So do it in that context. Next, you have ovarian cancer. This is something that I have seen show up more recently in your OSCE stations. So know what you're going to see when a patient has ovarian cancer, especially Meeks syndrome, right? Is something they love to test you on. Ascites with ovarian cancer and a mass in the adnexal regions. So just do this well. They will test you on this. Make sure you have pelvic inflammatory disease. This is also something that I've seen shown up in OSCE stations a lot in your multiple choice questions as well. So know all the different infections that could cause this, know the complications of this. So if a patient has chronic pelvic inflammatory disease or recurrent pelvic inflammatory disease, they may show up with infertility. So just do this really well. Also, another very commonly tested topic, placenta previa, is something they like to test you on as well. Know how to explain this to the patient by drawing a uterus and drawing the baby inside of the uterus and explaining that the placenta is in a position where the baby could be compromised, but it does revert in 90% of cases. So just do placenta preview really well for your OSCE stations, because you'll have to explain what's going on to the patient and you need to know the management. Placental abruption. This is something that could show up in an emergency scenario, and this is something that you should know really well, because you might have to resuscitate the patient. I have seen it shown up more so in your multiple choice questions, but that doesn't mean it cannot show up in your OSCE stations. So know the management really well, know the investigations really well. Postpartum hemorrhage. This is something that shows up in your sim mannequin station. So simulation mannequin, where you have to resuscitate the patient, where you have to save the patient's life in an emergency scenario. So postpartum hemorrhage, really important. Know what you're going to do in this case. So ABCDE approach and how you're going to resuscitate the patient. Preeclampsia, gestational hypertension, we've talked about this. Sepsis, this could show up post-delivery, so post-C-section, also in the case of STIs maybe. So yeah, sepsis is something you'll study in other areas as well. Substance use disorder. Okay, so substance use disorder, this may show up in the case of pregnancy and a patient has substance use problems in during their pregnancy. So you need to explain what adverse effects it's going to have on the baby, and you're going to have to know the steps you're going to take to help this patient. Syphilis, again, another STI. Just know the presentation of syphilis, gonorrhea, chlamydia, and how to manage these patients, what antibiotics are used, and how these infections could affect the patient's pregnancy or the patient's baby after delivery is something you should know as well. Termination of pregnancy. When do you terminate a pregnancy? When do you need to terminate pregnancy? You should know these cases really well, and how to talk about that to the patient. Trichomonas vaginalis. You should know the difference between this and Gardnerella vaginalis, like I said, and this is tested commonly in the case of your pelvic inflammatory disease stations, but also in the case of just a patient showing up with vaginal discharge, and you need to know the investigations you need to do and the antibiotics you're going to use. This shows up more so in your multiple choice questions. Urinary incontinence, so stress incontinence. So Kegel exercises, something you should know, something you could advise the patient. And usually these patients have stress incontinence, so just know what you're going to do for the patient in the case of urinary incontinence. Know the drugs you could use if all the other measures fail. Urinary tract infection. This is important in the context of pregnancy, because you cannot use certain antibiotics when a patient is pregnant. So urinary tract infections themselves are something that you can treat. It's fine, but if the patient is going to become pregnant or is pregnant, you need to be careful with the antibiotics that you're going to be prescribing. Varicose zoster, so herpes, another STI potentially. So know how this is going to present, what you're going to do, what advice you're going to give the patient. And in the case of STIs, advise contraception, barrier methods, all that kind of stuff as well. Vasa previa, I haven't seen this show up as much in the past, but do it well for your multiple choice questions, definitely. I'm not sure if this is going to show up in your OSCE stations, but just know the ins and outs of vasoprevia. This will be a relatively newer case, I guess. Next, you have venous thromboembolism in pregnancy and purpurium. So, venous thromboembolism in the case of pregnancy and purpurium is something that you should do well. So, stockings and the antiphospholipid syndrome and blood thinners is something that you should know really, really well. So, yeah, do obs and gynae really well, do all these presentations really well, and yeah, you could be tested on any one of these things, and you can be sure at least something is going to show up in your exams. Okay, so hope this helped. See you in the next video.